doctors are offering antibody tests, which are meant to show if someone has been exposed to COVID-19 in the past.
But are they worth the money? And what is the benefit of actually knowing whether or not you've had prior exposure? Our Tracy Sears investigates.
On Tuesday, Henrico County will wrap up its drive-through testing site after nearly a week and a half of offering free antibody testing to first responders and other county employees. The test results could help determine the number of people who may have been exposed to the COVID-19 infection and have since developed antibodies to help fight the virus.
It's arming our decision makers with information.
Several other organizations, including GRTC and the Virginia Department of Emergency Management, also took part in testing. While the tests may offer insight and some peace of mind, infectious disease experts still have concerns as testing is not yet FDA approved.
Unfortunately, we have some barriers. Number one, the antibody testing is in development. We don't know the accuracy of the test yet. And more importantly, we don't know if someone who is antibody positive will actually be immune to infection and for how long.
The antibody test isn't checking for the virus itself. Instead, it looks to see whether your immune system, your body's defense against the illness, has responded to the infection. Through a blood test, doctors can look for two kinds of antibodies: IgM antibodies, which develop early in the infection, and IgG antibodies, which are more likely to show up after you've recovered.
If people just want to test to see if they've been exposed, I think it's reasonable.
Family physician Dr. Sterling Ranson says high-risk patients, or those who feel confident they've been exposed to the virus, should consider an antibody test, especially now that plasma donation is being encouraged to help those people currently fighting the virus.
I think probably the biggest reason that I would recommend doing it would just be for assessment of the prevalence of the virus in the population. And that's going to be the big thing as we try to get back to work. We need to know exactly how much of the virus is in our community.
And that's what Henrico officials are hoping testing will indicate. Of the 1,800 people tested so far, the presence of antibodies has shown up in 52 cases.
We can find any way to provide more information. They can provide just a little bit more certainty or a little bit more factual information where we can make decisions, the better off we're going to be as a locality and as a community moving forward.
In Henrico County, Tracy Sears, CBS 6 News.